Good morning, everyone. I appreciate everyone getting here on time. We have a very packed agenda. My two most favorite things to do are, one, welcome you all here, and two, to introduce Dr. Ruth Lawrence, who truly needs no introduction in this room, but we will do more of that later in the day. I want to give her the chance to open this very special 9th Summit on Breastfeeding. Thanks.
Good morning, and I can't welcome you to Washington. I guess you need to welcome me to Washington because I'm from upstate New York. We've had 8 previous summits, but all of this began in 1984 with C. Ever Koop when he was the Surgeon General, and he decided that one of the most important things he could do while he was in his job was to get women to breastfeed. We held a program in Rochester and invited experts from across the country. And he was elegant in his white uniform. He had his very strong sense of presence. And he said, when we finished, we must reduce the barriers that are keeping women from breastfeeding. 25 years later, to the day, here in Washington, we had the first summit, and Dr. Koop spoke to us via television and said the same thing. You must reduce the barriers. And so we've been at it for 8 full years. We are still not where we should be. And it's not about how to breastfeed, so we're not going to tell you how to breastfeed today. We need your expertise. We need to figure out how to have health change, how to have policy change in favor of breastfeeding, how to budget for health care, and how to increase public knowledge and public attitudes regarding breastfeeding. There are pockets of total ignorance. So this is why we have gathered you all here together for the 9th time. And I'm going to ask the president of the Academy of Breastfeeding Medicine, Julie Scott Taylor, to say a few words. She is the Senior Associate Dean for Academic and Student Affairs in the American University of the Caribbean. She's a family physician. She did her undergrad at Harvard. She got her medical degree at the University of Massachusetts. She did her residency in family medicine at Brown in Pawtucket. And she took a 2-year faculty development fellowship at Boston University. She has a master's degree in epidemiology, and all of this makes her one of our wonderful presidents of the Academy of Breastfeeding Medicine. So if Dr. Taylor would come to the mic for a moment.
Thank you, Ruth. Thank you so much, Ruth. I'm the current president of the Academy of Breastfeeding Medicine, and it's an absolute privilege to welcome you here on behalf of ABM. As you heard from Dr. Lawrence, I'm an academic family physician, and I work in international medical education and in international maternal-child health. My job is to introduce ABM to you at the highest level. We're a global organization of doctors. We have expertise in what's a relatively new field, breastfeeding medicine. The organization is more than 20 years old, and the number I got this morning, because it changes pretty frequently, is we have ABM members in 57 countries, okay? We are primarily focused on education as an organization, so we have a journal that's published 10 times a year. One of our signature products is our clinical protocols, and you can find those on our website. We have policy statements, we have position papers, we hold conferences, we have podcasts, we have regional networks and events. We're just a very vibrant organization. And one of the other things that we do is we have key partnerships with leaders around the world who are invested in maternal child health and breastfeeding. And of course, we have summits. So welcome you all here today to this wonderful event. I would encourage you to use the summit to learn more about our organization. There are many materials that are on display in the entrance area. We have many key leaders here. So for anyone who's on the management team or a board member of ABM, can you raise your hand? Can I just make sure? We've got the editor of our journal here as well. So please make sure you meet each and every one of us in the ABM leadership team during the next 2 days. Expand your networks and build your connections. So I want to thank you for being here today and tomorrow, and for your leadership with improving the health of mothers and babies and families around the world. So I'll turn it back over to my colleague and mentor and hero, Dr. Ruth Lawrence, to introduce our first speaker.